schedule is your own, so you can pursue whatever passion you have. For example, I'm really into surfing and traveling the world as well as global medicine. So I get to decide when I work and where it fits into my lifestyle.
Many hospitalists choose locums as a lifestyle because they like the variety, they like the travel, they like the freedom of choice, they like the freedom to maintain their own schedule, and they like the money.
We're told where we need to be and what we need to do for so many years of our life. And then you graduate from residency. And for me, I didn't want to be told when to work. And I didn't want to be told when to play. And so this for me was freedom.
As an HR person, I'm more interested in building good functional teams. Personality, frankly, makes a difference, and that's not something that people can change. In this day and age, one of the huge challenges is trying to stay on top of a variety of electronic medical records. The electronic medical record has made, in my view, being a locums much more difficult than it was before. I think for that reason, lots of people tend to seek locums opportunities over a span of time. It's so that they can stay in a place, get to know the place and the players. That makes hospital medicine in general much easier.
So 10 different EMRs in the last 5 years, that in itself presents a challenge. You have to be pretty versatile with your technology skills. Once you get over that, and generally it takes about 5 days really to get to know all of the nuances of the system. And those 5 days are pretty difficult because you're there extra hours kind of trying to figure out all of those different nuances. But once you get over that, it's 5 days. And then it's great because you now know another EHR. You now know a little bit more about the culture of the hospital, and you also can find your way around.
I have heard about programs that will hire in one locums after another and then expect them to do a level of a number of patient encounters per day that we would consider bordering on abusive. My company doesn't do that. We're using locums usually for a specific reason.
With my first job as a hospitalist, right out of residency, they handed me a list of 35 patients. And I said, so who am I splitting this list with? And they said, nobody. Those are all your patients. And I was given a 10-hour shift to see 35 patients, which is just isn't safe. And I learned from the get-go that I was unwilling to compromise patient care with what a hospital was giving me. Decide what your cap is and tell the hospital that before you start. If you feel comfortable seeing 16 to 18 patients, then tell them that and have that written into your contract.
Do some research before you sign with a locums company. There are good locums companies and really terrible locums companies. Of course, I'm always looking for a locums who says, I'm really looking for a permanent position, and if this works out mutually, I would love to entertain a job offer from you. And I've worked with people who are represented by locums companies who, in that circumstance, would want a conversion fee up to a third of the annual salary, which is a huge amount of money. The market rate is substantially below that. So basically, do a little research, consider getting some references, know about a locums company before you sign with them, and be honest about your strengths and your capabilities. Be honest about if you just can't deal with a small hospital where there are few medical or surgical subspecialists, be honest about that. If you just are not going to be comfortable in a small hospital intensive care unit, be upfront about that.
So I always make sure I have two hospitals that I'm credentialed with, because generally hospitals have 60 days, 30 to 60 days to tell you that, hey, we've got a full-time employee coming on to replace you. So the key is to have two hospitals at any given time that you're credentialed in so that you can be able to work as much or as little as you want, knowing that you have a backup. And the beauty of Locum Tenens Hospitalist is you get to be an entrepreneur. You get to build your own business, and you learn a lot by doing that. Having a professional corporation, being able to decide which insurances you need. There's so many huge life lessons you get to learn, and you do have to be entrepreneurial.
Locums, by their nature, have to be more adaptable than other physicians. And those who are not very adaptable are going to have trouble and not going to like it.
Doing. If locum tenens hospitalist is something you're interested in doing, try it. Just go for it and see what doors open to you.